Hello, Mr. Uğur.
Hello.
Do heart valve diseases generally progress silently? Which symptoms should patients take seriously?
Yes, heart valve diseases generally progress silently. These insufficiencies, which start at a mild level in the heart valve structure, are classified from first to fourth degree, and usually these valve insufficiencies or stenosis that start mildly progress insidiously, advance slowly, and the patient continues life without any symptoms at first. However, during this insidious progression, the heart gradually enlarges, the chambers enlarge, arrhythmia occurs, and the patient's complaints gradually develop. Therefore, we can say that heart valve diseases progress silently. Patients especially have shortness of breath as a primary complaint. They should take this seriously, especially when shortness of breath occurs with exertion, meaning with movement. Patients should consider that this might be a heart issue and must definitely consult the relevant doctor. Additionally, this shortness of breath can be severe enough to wake the patient from sleep at night.
Can heart valve replacement be done today without open surgery? How comfortable is it for patients?
Today, with modern technology and advancements in surgical instruments, heart valve surgeries can be performed safely with smaller incisions in robotic surgery.
In patients, the greatest satisfaction we observe, of course, is the lack of aesthetic concern because it is done with a small incision. Coronary artery disease, which we refer to as the disease requiring bypass, is still the leading cause of death worldwide. Coronary bypass surgery is still the gold standard surgery for patients with coronary artery disease, and it used to be performed by cutting the breastbone. But now, with technological advancements and developments in surgical instruments in recent years, it can be comfortably performed through small incisions from the lower chest area, the breast region, or with robotic surgeries.
Is varicose veins really just a cosmetic issue, or if left untreated, can it seriously affect heart and vascular health?
Varicose veins, while actually being an aesthetic issue, are more of a vascular disease.
This, in the later period, stops being a cosmetic or aesthetic issue for the patient and leads to the emergence of some complaints, especially pain complaints, tingling in the legs, numbness, what we call nighttime restlessness, burning in the soles of the feet, burning in the legs, and cramps, bringing the patient to us with such complaints. Of course, does this cause a major problem in the heart? Meaning, will it lead to a heart condition in the future? Varicose veins alone do not cause a heart condition in the future. Varicose veins are not just an aesthetic issue. In the future, as the disease in the veins progresses, complaints start to appear in the patient. Yes, varicose veins are primarily an aesthetic issue. However, varicose veins, especially as a vascular disease, involve the process where the veins bring blood back to the heart. And due to the effect of gravity, the blood pulls downward, meaning in our legs and feet, creating a chain of complaints.
Who is Professor Dr. Uğur Göçen?
I am a specialist in cardiovascular surgery. I completed my education, which I started in 1994 at Çukurova University Faculty of Medicine in 2002.
Later, as an assistant, I completed my specialization training in cardiovascular surgery, which I started 23 years ago and began active duty in 2009. For many years, I served as an assistant professor and associate professor in the Department of Cardiovascular Surgery at Çukurova University Faculty of Medicine. For the past 7 years, I have been serving as the chief of cardiovascular surgery clinic at Middle East Hospital. In our clinic, we can comfortably perform all heart and vascular surgeries. To list them, we successfully perform heart valve surgeries through the armpit using open and minimal methods, coronary bypass surgeries from the chest area using open techniques, and aortic aneurysm and dissection surgeries. We successfully perform repair procedures with stent application in thoracic aorta and abdominal aorta aneurysms and dissections. We also actively perform peripheral artery surgery, that is bypass surgeries for vascular occlusion, and varicose vein surgery in our clinic. Especially throughout my education, I have been successfully performing pediatric heart surgery for 23 years, and I can comfortably perform any type of pediatric heart surgery for all children from newborns to a certain age with any pathology.